scrubs. What are the most effective areas for liposuction? Who's asked this? I've got to be honest. That's one of my lot asking that, isn't it? Is that a real patient asking that? Well, thank you for asking. Hips are really good. Combined with a tummy tuck. Hips here. Once you've done a tummy tuck, sometimes you've got a bit of fullness. Someone was saying they've got a bit of fullness up here in the upper abdomen. They've had a fleur-de-lis. Sometimes beneath the rib cage. Sometimes people will talk about doing it beneath the rib cage at the time of the tummy tuck. I don't, because I worry about the blood supply, because you often don't need it. Often it pulls through. If it doesn't pull through and you've still got a bulge in your upper abdomen, then that might help. Liposuction might help those areas. Lateral chest wall, if you've got breast reduction or just you've got fullness above your bra strap. Outer thighs, not so much inner thighs, not so much central abdomen, not so much arms. Those are areas that people often want liposuction, but it doesn't give a significant degree of skin retraction. That's why I normally point people in the direction of the VASA and the assisted forms of liposuction to see if they'll help. I don't know if they do, because I don't do them, but I just say, look, the people who do them say that they do, so better off talking to them to get a balanced opinion. Thank goodness for that. My flat is up 6 flights of stairs. Hold on a minute, Olivia. Not 6 flights of stairs. I don't think you want to be doing that too often. I thought you meant just 1 stairs up to the bedroom. 6 flights is a bit extreme. No, hold on a minute. It's getting out of control. Don't avoid stairs, but don't do 6 flights of stairs after a tummy tuck. You've got to take it easy. Go in the lift. Kimberly Richards, #AskJJ. #AskJJ. Yes. I can't believe it's taken off. It's taken, how many years have I been doing this? It's taken off. It's Cassia, I'll tell you. I've lost a large amount of weight and lost a lot of my breasts, which is great, as I hated them so big. I would like to have breasts which stay when I lie down or take off my bra. Will this require an implant or an uplift do? I think an uplift would do a lot of it, but I wonder if what you're talking about, which is having them staying there, depends how much breast tissue you got, Kimberly. If you've got a fair amount of breast tissue, it's hard to get them to stay there, to be honest with you. When you lie down, they're going to move. Gravity's going to move them. The thing that doesn't move is an implant. So an implant does stay there. But when we put an implant in, we want it to stay with your breasts. So we don't want the implant to stay there and the breast to fall off the side. So if you've got no breast tissue at all and you have implants, they do sort of stay there, like you're describing. But if you've got some breast tissue, I've got to be honest, Kimberly, it's hard to do the thing that you're describing. And sometimes people do say, oh, when I lie down, they move to the side. And you're like, well, that's natural. That's what breasts do. But I understand people don't want them to do that. I mean, a lift will make them better. They'll fall less far because they'll be tighter and they'll be higher up on your chest, but they'll still fall. So it's about aligning your expectations as to what you want. So it will be better, the fall, but it will still be there. There'll still be a bit of falling going on. And an implant will make them a bit more on there, but they'll also make them bigger. So the question is, do you want them bigger? There isn't a lift. Now, I think Olivia's talking about a lift for the flats now, not a lift for the breasts. Okay. Don't we worry about going for a few weeks? Good. Melody, #ask. Melody, it's #AskJJ. I hate to pull you up on it because I respect you for using it. But if we're going to use it, because last week we had a #JJ, so we've had a #JJ. Now we've had a straight up Ask JJ. It's #AskJJ. Okay, just to pull you up on that. Sorry guys, need to go. Oh, that's what it was. Okay, right. There you gotta go. All right, Melody, thanks for coming and thanks for trying to use the hashtag. But next time, #AskJJ. But yeah, excellent. Thanks, Melody. Have a nice evening. Thanks for letting us know. Right, Melody's gone, guys. We can carry on. It's all right. We'll carry on. Blimey, I've got loads of questions here. What's this one? What's the most effective? Have I done that one? I've done that one. Can use a liposuction? Heavy talk here. Can you use liposuction on somebody? You can, and I think it's good for here, as I say, usually after a tummy tuck, because anyone who's got a natural distribution of fat, it'll always be in the lower abdomen more than the upper abdomen. So you want to address the lower abdomen first. And in my experience, the best way to address the lower abdominal fat is with a tummy tuck, but I understand, or a mini tummy tuck, but I understand a lot of people aren't candidates for that. They haven't got enough for that, and they want liposuction. I see a lot of people who don't want a tummy tuck and want liposuction. I find that the skin doesn't retract significantly for the central abdomen, so I don't like liposuction on the central abdomen. As I say, the assisted forms like Vaser and Smart Lipo, and there are others, I can't remember the names of them, but anyway, other types of liposuction do say that they cause some degree of skin retraction, so they might be something that you could consider. But in my hands, it's not great for the central abdomen. There you go, Olivia. Hashtag AskJJ. Thank you for demonstrating that, Olivia. Very good. What do you class as one large area for liposuction? I don't think you should. I don't really like it so much when patients get into the sort of the way we describe liposuction. So liposuction is described in two ways: small, medium, large, extra large, and 1 area, 2 area, 3 areas. And I prefer the small, medium, large, extra large, to be honest with you, because then you've got sort of like 2 areas. Like hips, is that 2 areas, or is that 1 area because it's hips or thing? So I would call that medium, which would be equivalent of 2 areas. 1 area is a small bit like a chin, or a little area, a little small localized area. There's no such thing as 1 large area, so that would be medium. There isn't a 1 large area. That would be medium. So that's why I prefer small, medium, large, extra large. But that's a technical thing for us. We'll examine you and see you and give you a quote, basically. Is it appropriate to have liposuction under local anesthetic with sedation? Yeah, I would think it's a little bit uncomfortable because of the so I think you need sedation. It's possible to do it under local anesthetic, a very small area. I've never done it under just local anesthetic, to be honest with you. But local anesthetic and sedation, absolutely yes. No problem at all.